Hi, I'm Dr. Carine of Carine Pediatrics. So we're going to have an update today about COVID, right? And as we all know, we've been getting recommendations on wearing masks in public. I wanted to talk about that a little bit more because I see a lot of confusion about when to wear masks and why to wear masks and who needs to wear masks. And so let's just make this a little bit easier for you, I hope. First of all, this disease is not going anywhere anytime soon. So I keep trying to remind you guys of all that even though we watch the curves and we see the effects of social distancing being positive, Ohio is doing great with its medical resources, and actually nationwide, we've done such a good job at social distancing that we have not run out of ventilators or ICU beds in any city in America, which has been really amazing and quite a testament to our healthcare system. As we go forward, we're going to continue with some of these social distancing measures as we get our country a little bit more open in kind of staged responses. So you're going to see coming out in the next couple weeks more and more, leniency in regards to where we go and what we do. But because the virus won't be gone, the masks are here to stay for a while and social distancing will be here to stay for a while. So let's talk about that. There is a very concise science to this notion of social distancing, meaning that when we say there's a stay-at-home order, what that does is it really limits how many people can congregate for the potential of spreading. But when we say you are out in public and you keep 6 feet, what that does is that actually reduces how much virus circulates, because we know it lives on surfaces. We know that it comes out when you breathe and if you cough and you sneeze, but even just being around someone who's talking and breathing who's infected can spread the disease. But when you keep that 6 feet distance, you create enough distance that the virus really doesn't have enough energy or propulsion to get to the other person. The goal in social distancing is not to keep you from ever being exposed to one virus particle. The goal of social distancing is that you keep your viral exposure low enough that it acts a little bit more like a vaccine. So if you do catch it, you get it really mild. We see a lot of that asymptomatic cases in the case of COVID. And those are situations where the person was exposed to a small enough of the virus that their body effectively gained immunity to it, which is great. The reason why healthcare workers are at such great risk is because they are around coughing and ventilators, and they're up in the face of multiple people in very large exposures. So that's why they need those N95 respirators and goggles and gowns, because the number of viruses they're exposed to is so much higher that their risk of serious disease goes up. So as we go out in public, this 6 feet distance and masks is there to just decrease the viral load without the expectation that there will be zero. So when we add the masks to that equation, it makes it even better, where people aren't breathing on cash registers or on things out in public or door handles, that if we clean our hands and we mask ourselves, we really reduce the amount of virus that's going to be on surfaces. And if we're talking near someone, we reduce how much virus ends up in the air. But let's talk about what masks are not for. As I talked about with the healthcare workers, those N95s are important. Those really strong, fit to your face, tight masks are intended for when you are around someone who is spilling a lot of virus into the air. Then you actually need to filter everything that healthcare worker is breathing in and out of their mouth. They are completely unnecessary in a social distanced environment because you are not exposed to the virus by just being out. That's not how that happens. It's that close distance, that person talking on you, the touching of surfaces and touching your face is still the predominant way community spreads. So you do not need to wear an N95 mask in public. That's completely unnecessary. And there is a reason why they keep saying, do not wear them. Healthcare workers need those, but you do not. And you do not need to wear any mask if you are walking alone outside and exercising or riding your bike or out in the park. Masks are completely unnecessary out in the open air. They're unnecessary in your cars. I always think that's kind of funny when I see people driving around in their cars with their masks on. You are in your own space. There is absolutely no need for you to have a mask on. That's your car, your space, you're fine. They're not necessary at home, of course, unless you have high-risk people in your home that you're trying to protect. They are necessary when we go out into public places. I'd really like our patients to take that in mind and say, we would like you to wear masks when you come into our office. Our staff are wearing masks for the same reasons, to keep each other and to keep you safe. And reciprocally, we'd like you to wear masks or some type of face covering when you come into our office. We'll get to kids in a little bit. And you need to wear them in the grocery store. You need to wear them if you go to visit a friend or someone that you need to go into their home for. You should wear a mask in their home because you're sharing spaces and you're breathing on their spaces. These masks are going to be here for a while, and they really don't need to be complicated. So you can see online, there's some simple ones the Surgeon General has shown us with just like rubber bands and a piece of fabric. You can wear a bandana or a scarf because the purpose of these masks is not to filter the air. So those N95s are necessary when you're in close contact with viruses, but when we're just trying to spread it in the community, you can wear anything that covers your face lightly and keeps it from circulating. So this is a very important point. We are not wearing masks for ourselves. So when you wear a bandana or a surgical mask or a homemade fabric mask, you are not wearing it for your protection, which is why it does not need to be super thick. It doesn't need a charcoal filter. It doesn't need to have special fabric. You're wearing it so that when you talk or you sneeze or you breathe, that you're keeping your own germs to yourself. So the masks are for the protection of the people around you and not for yourself. So this goes back to when and who would someone need to wear it? Well, we know for a fact, for sure, asymptomatic people carry this disease. We still have some details as to how many people do that or how long they spread or how many people that looks like. But in a recent study that they just did of pregnant women in New York, 15% of the women that they tested were positive for COVID with no symptoms whatsoever. Like 13.5% had no symptoms and 1.5% had mild symptoms. So when you say to yourself, well, I don't have a fever and I don't have a cough, I don't have to wear a mask, please, that is not true. So our reason for wearing masks is for the safety and protection of other people, whether you have symptoms or you don't. So everybody wear your masks in public, especially when you're in confined places. So this goes to children. The AAP has said no masks for children under 2. And again, because a mask is for the protection of other people, not for the child. So children are at very low risk of COVID and they aren't really out and about that much right now. For children over 2, my guideline would be if your child will comfortably wear that mask in public without fussing with it, then yes, they should wear it. But if your child is tempted to play with it and take it on and off and touch the cart at the grocery store and then touch things in the store and then go back to touching their face, the mask would actually be worse than if you left them with no mask. And because children are so good at just getting into things and being around and touching lots of surfaces, really it's probably best that for the most part we keep children out of communal spaces because they do spread it when they have no symptoms and they're just not good at doing good hygiene. So, they want to play with the register and they want to play with the cart and they want to pull things off the shelf, and we're really trying to reduce how many surfaces we breathe and touch during this time. So if you can grocery shop or if you can go somewhere without children, that would be great. In our office, we'd really prefer that when you come in for an office appointment, you only bring the children that are going to be seen that day. For the same reason, just reducing how many children are running around and touching surfaces. I hope this helps you. I think there's a lot of confusion and a lot of scared ideas out there. I just want to remind you again, COVID is really very safe for our children. There's very few illnesses that are serious in kids, and as the data comes in, that continues to be true. There's always outliers, but we have children who die in car accidents and of other freak things as well. And COVID really doesn't pose them more risk than what a normal life of a child would pose. So I want you to feel secure with that. And as we go forward, what we're really talking about is how do we get back our life as Americans safely for those that are high risk and for our healthcare system. Thanks, and you have any questions, we're available, of course.